Welcome to this dentinal tubules live stream on the 10th of November 2016. This is about medico-legal scenarios. For those who are watching this live either at home or for those who are watching this live with one of our study groups, we will be going live at 7 p.m. with Dr. Simon Zachary and Dr. Victoria Holden, who will provide presentations and answers to this scenario. But while you're waiting, we can go over the scenarios and you can have discussions with your groups. We look forward to welcoming you tonight. For those who are actually viewing this a lot later, the video will give you all the information and the presentations. We look forward to having this discussion on dentinaltubules.com with the technology of Tubules Live. The scenarios we will be discussing are negligence, duty of candor, and consent. Let's go to the next slide. Please note, all scenarios have been invented for the purposes of this exercise and are entirely fictitious. They are not real scenarios, and any resemblance to anything real is not intended. Let's talk about the negligence scenarios. For each scenario, what you must consider are what are the possible allegations of breach of duty, what are the possible allegations of causation, what might be the damages for any treatment required as a result of any breach in duty or any established causation. Let's look at the scenarios. The first one, Dr. Holden sees a new patient. The patient is 28 years old and has no presenting complaints, but he is a smoker. Dr. Holden has taken bite wings as part of the examination, but the software loses the image and it takes a while for it to be retrieved. By this time, Dr. Holden is on annual leave, and the post-it note reminding her to report on it has disappeared by the time she returns to work. The patient does not attend when she gets a 6-month reminder because she has seen another dentist for an examination instead, who did not take any radiographs because they understand that they have been recently taken and there were no problems. The patient then attends to see Dr. Holden 18 months later with severe toothache. The upper right 6 has subgingival caries and is deemed unrestorable, so an extraction is performed. The patient gets a dry socket, which takes 3 weeks to fully resolve. She requests a copy of her notes and becomes aware that the cavity was present at the upper right 6 at the initial appointment. Solicitors get involved. What are the clinical negligence aspects in this? Is there any possible allegation of a breach of duty? Is there any possible allegation of causation? What are the damages if any treatment is required because there has been an established causation or any results of breach of duty? Discuss with your team. Dr. Simon Zachary and Dr. Victoria Holden will come live at 7 p.m. giving you presentations and answers to these scenarios. Let's look at the next clinical negligence scenario. Dr. Holden fits a post-crown, and the patient returns a couple of weeks later complaining of a swelling near to the tooth. A periapical radiograph shows that the root is perforated, and the patient is told that the prognosis for the tooth is poor and it needs to be extracted. Dr. Holden offers a refund for the post-crown, but the patient refuses as they want their tooth to be replaced. Dr. Holden refuses to pay for an implant and the patient then goes to a solicitor. The patient is 45 years old. What are the allegations of breach of duty in this case? What are the allegations of causation in this case? If any causation is established or if there is any breach of duty, what are the damages to treatment? Discuss with your study group. Here's the third scenario. Dr. Holden takes an upper left molar out, which has irreversible pulpitis from a crack, and the patient says that they cannot afford to have root canal treatment and a crown. The patient is already missing the upper left 7, which was also extracted because of a crack. The pre-operative radiograph shows a very low-lying sinus. The patient is a type 1 diabetic. During the extraction, the distal root fractures. Dr. Holden uses an elevator to flick out the remaining root fragment. Although she can't be sure what happened to it, she thinks it may have gone up the suction. A post-operative radiograph shows that there is no root fragment visible, but there is a large communication with the sinus which is over 4 mm in width. Dr. Holden reassures the patient that this should heal, and it appears to do so. Despite the patient complaining of occasional pus dripping into her mouth, no fistula is recorded at the subsequent examinations. The patient then visits the general practitioner, who eventually refers the patient to ENT. An ENT consultant arranges for a CBCT scan and detects a 4 × 5 mm root fragment in the sinus. The patient undergoes a general anesthetic to remove it, and the sinus problems resolve more or less immediately. The patient contacts a solicitor. Discuss with your study group, or if you're watching this on your own, think about it. Is there any allegation of breach of duty? Is there any allegation of causation? What are the likely damages to treatment that are needed if there is any established causation or if any breach of duty has happened? These are the 3 negligence scenarios. Dr. Holden and Dr. Simon Thackeray will be live at 7 p.m. to give you a presentation on negligence and give you answers and discussions related to these scenarios. This is Tubules Live. Let's look at the next topic. The next topic is duty of candor. And for each scenario, please discuss: is the professional duty invoked? Is the statutory duty invoked? i.e., is the incident notifiable? How would you manage the situation? What are the possible consequences of not meeting your obligations under duty of candor? The first scenario is as follows. Dr. Holden sees a patient who needs orthodontic extractions. She has not received the treatment plan from the orthodontist, so asks her receptionist to quickly call and ask for confirmation of which teeth she is to extract. The teeth to be extracted are misnotated on the fax she is sent, and instead of extracting the lower second premolars, Dr. Holden removes the first premolars instead. Discuss: what is invoked here? Is the professional duty invoked? Is the statutory duty invoked? And how would you manage such a situation? You need to know what are the consequences of not meeting your obligations under the duty of candor. Let's look at the second scenario. Dr. Foote is undertaking a tricky endodontic referral where the root apices are seating close to the ID nerve. He has an agency nurse who has not attached the correct irrigation needle to his syringe and passes it to him whilst he is looking through his microscope. The hypochlorite escapes into the apical tissues. The patient reports 1 week later that they have a numb lower lip. Is the professional duty invoked? Is the statutory duty invoked? How would you manage this kind of a situation? What are the possible consequences of not meeting your obligations under the duty of candor? Discuss this with your study group or have a think about it. The third scenario for duty of candor is here. Dr. Chan is seeing a new patient who has completed their medical history form and advised of an allergy to kiwi fruits and to penicillin. Dr. Chan puts on some latex gloves, and during the examination the patient starts to get an itchy mouth and has difficulty breathing. They quickly deteriorate, and it is clear that the patient is having an anaphylactic reaction. Adrenaline is administered, and the patient is taken to hospital where they make a full recovery. If this happened to you, what are the questions to answer? Once again, consider: Is the professional duty invoked? Is the statutory duty invoked? How would you manage the situation? What are the possible consequences of not meeting your obligations under the duty of candor? These are the three scenarios discussing the duty of candor. Dr. Simon Thackeray and Dr. Victoria Holden will be with us shortly to provide us presentations on this topic and also to discuss answers to these scenarios. This is Tubules Live, which will be beamed from the Henry Schein Dental Education Centre in London to the world. Our next topic is consent. This is very important for us in today's medical legal age, and various aspects of consent will be discussed today. Let's look at the scenarios. The first scenario: a 16-year-old patient attended with his mother for treatment. The mother stays in the waiting room. The treatment you're planning is a root canal treatment on an upper premolar. When in the chair, the patient refuses treatment of any nature, saying that they know their rights. They are quite an intelligent teenager and perfectly rational, and that they do not want the root treatment as they're not having any problems. What do? There is a risk to the patient of losing a tooth in the aesthetic zone, not to mention pain and swelling, and your explanations are falling on deaf ears. The patient categorically refuses the treatment and leaves the surgery. They insist you do not speak to the parent. The mum then comes into the surgery and asks you what has just happened. The mum is particularly keen on having the treatment provided as she realizes the benefits long term. Explain what would you do in this situation with regard to the treatment, the discussion with the parent, and how would you move forwards? Would this situation have been different if the parent was in the room during treatment? Dr. Simon Thackeray and Dr. Victoria Holden will be providing answers to this scenario and providing a presentation on consent in tonight's Tubules Live. Discuss this scenario with your team, with your study group, and if you're on your own, think about it. What would you do? Let's look at the next scenario. One of your regular patients, who is quite elderly, attends for emergency treatment on their own. You have been treating them for years, but haven't seen them for about 18 months. You know they've always been very keen to save their teeth at all costs. When they arrive today, you realize that they are very confused and have quite obviously deteriorated in their mental abilities. However, they recognize you and that you are their dentist. They sit in the chair and point to a broken tooth. The tooth is borderline savable, and you know that in the past the patient has had root canal treatment and crowns on other teeth. They tell you to just get on with the things to save the tooth. You begin a root canal treatment and charge the patient accordingly for the work done today. Later on in the day, you get a phone call from the patient's daughter querying the bill for what happened today. They tell you that the patient has become increasingly confused, and as such they now have a power of attorney over them, and you shouldn't have treated them without the consent of the relation. They're now going to report you. Is this right? What would you have done in this situation? Think about it, discuss with your study group, discuss with your team. Dr. Simon Thackeray and Dr. Victoria Holden will be with us shortly from the Henry Schein Dental Education Centre to discuss these scenarios and provide answers. We look forward to having you in the audience. Let's discuss the final scenario. You're about to replace an anterior crown on a relatively new patient to the practice. Their normal dentist is off ill and you are the locum. You have made sure you explained the preparation procedure and the choices of material for the definitive crown have been checked as well. The patient signed the consent form previously. The patient does look familiar, but you can't quite place them and you don't recognize the name. The procedure goes well, and the patient is happy with the temporary crown. However, later that week, the patient appears on TV in an interview, and you recognize them as someone quite famous who uses a different name in public. You immediately notice the temporary crown has become much yellower, and as the interview progresses, the crown actually drops out, causing the patient obvious distress on live TV. 10 days later, you receive a solicitor's letter claiming that the consent you had was not valid, and there are damages that are being claimed for the distress and the damage to their client's profile. Does this patient have a case? What would you do in this situation? What are the implications of consent? These are 9 scenarios on consent, negligence, and duty of candor that you can think about today or that you can discuss with your study group. This is going to be a Tubules Live beaming from the Henry Schein Dental Education Center and will be presented by Dr. Simon Thackeray and Dr. Victoria Holden. We look forward to welcoming you to discuss these scenarios and hope that you will walk away with a lot of information in this day of medical legal importance. This is Tubules Live, beaming from the Henry Schein Dental Education Center to the world. Discuss the scenarios and we will see you soon. This video will be on loop so that the scenarios keep playing, so that you can keep discussing them. Thank you.